know, what needs to happen. People are citizens.
Oh, I got you.
They're up against, they
Right.
have to understand. And the only way you get there is have these honest communications.
And we've got these beautiful new machines to show us any slide projectors.
Hey, we're having
We
this
don't know how to
meeting.
work them yet.
Oh, that's okay, we don't have any
So
slides.
every time someone does come,
She should have some PowerPoint slides. Very demanding, Ms. Bargo Hafner. Oh,
The guy that surprised me was the guy from Northampton. I'm thinking, how many black guys are there in Northampton? I'm like, 10, 5.
I'm glad our police, because like, we don't know what we're talking about, we, you know.
because I am in flux.
Yeah, but you know what, numbers don't
I
lie.
skate today.
Well, the
You
other,
look at that hard data,
ooh,
you know, look at the data, and that's what you have to, then you know.
Do you ever go to Canova's and you put your kids on and you're really little, it's like 2 miles an hour?
it sounds good.
But it's like millions of cars.
Look at the data for individual officers. If you look at the pattern, but that's really not, that could be unfair too. But
I don't
if you
know.
got a history, if you look
I
at
don't know. Well, then Robin Barbosa.
80% of people all over are minorities,
yeah, sure.
I don't know how that adds up.
We call that DWB, driving while black.
Yes.
So those data numbers,
Don't breathe on top.
that's the important part that I'm like,
Here's the thing. I'm trying to work on
a lot
my
of
schedule.
honesty.
I was a,
Right now
I'm just thinking of this now, it was New Year's Eve, and we were at a friend's house on College Hill. I was in the DA's office, and part of my authority was in Easton, and they referred to the second shift police officers as headbreakers. There were about 5 guys that were like always physical. I mean, every stop with a young black kid turned into a fight, and then they had to cuff them, and they beat the shit out, you know, okay. We were coming home, I lived in Martins Creek at the time. It was about 1:30, New Year's Eve. Now, I did not know,
I don't know yet.
this was on 13th Street, I did not know that the police were there before.
Hey, your time is,
Down
Lori,
13th Street to go to Martins Creek, towards Forks Township, and there's a line of police cars.
Lori, it's your time.
See, there's activity.
Oh, okay, I have to go.
All I saw was
Thank you.
a young black
Can we,
kid, no shirt on.
do I have a committee? Tom's here. I'm missing Carrie. Is Carrie calling in?
He said he was gonna try and be here, so.
All
I
right,
don't know.
well, then we'll just open the meeting for Human Services, and I don't think there's any courtesy of the floor, is there? I don't know you without glasses, Jen. I'm like, who's that woman with Dawn? And it's Jen. See, that surgery is something. I should think about it, huh? Come on down. You're first on the Human Services agenda. So I don't know if you have a report that you want to give us. I have some
Dawn is
questions.
going to pass it out.
Sure.
And then while she's doing that, I did want to let you know, so from March 9th of this year, obviously, to June 16th, we were visited, I put in quotes, from the Department of Health on complaints, and they did a COVID survey, and all were unsubstantiated and cleared. 13.
13?
13.
And how many of those 13 were COVID-related? Because
Thank you.
obviously, people reacted to that.
About 7. I would say 7 of them were COVID-related.
Thank you for saying.
So if you're ready, so here is some of the items from our report. So census today is 526. We are still getting the referrals in. We are taking admissions. They do have to do a negative testing from the hospitals, and as well as from home. Hours per patient day, you can see for May, we had a total of 3.36. That was the average. So as much as we were down and out with staffing, we still maintained a 3.36 average. Cost per resident day is, April's cost per resident day was $236, with a year-to-date January to April of amount of $291 per day per the cost of a resident. The Medicare reimbursement rate, April's all-inclusive Medicare revenue was $452, with room and board portion as $387. We'll get you new numbers because Medicare was actually paying more for COVID cases. So you'll see those numbers start to fluctuate as we get more. Graysdale finances. So the revenues, January to April totals were $24,209,087. Expenses were $21,970, and that's because we had the IGT payout and received. So when you can see our net fund balance currently is still $3,311,000.
Now, when you put the capital items down, those are going to be for the total year, and they're not what you've done year-to-date.
Correct.
Thank you. Were they in the budget? Did we put those in the budget? We did.
Correct. We of course have been looking at everything before we spend, and doing only those necessary items where we need to do it. You can look at Graysdale's admissions and discharges. So the current numbers up here are reflective of June. So we had 33 admissions in June. We had 216 inquiries, which was up over the last 2 months. You can see the discharges to the hospital were 4, home and community 17. You can see our deaths were 26 for June. So the total discharges were 48. So obviously more people left us than we took in.
And of the decedents, how many of those were COVID?
Majority.
So there actually people did die of other reasons.
Yes. Oh, yes. So, and you can see March's total discharges were 53, April was 57, and then May was 71. So we completed our universal testing. So other than 4 people that are outstanding, I did get all the results in. So on the next page, you can see the stats. So before COVID, before the universal testing, we had 425 residents tested. And then during the universal testing, which the National Guard and GHR, which is a contractor for the Department of Health, came out and helped us over the weekend, Friday, Saturday, and Sunday. And they were able to do 296 resident tests and 568 employee tests. So to date, we have 146 residents that have tested positive, and only 3 of those came from universal testing. We have 12 people still pending test results, and those are people who we just maybe continually check them because they may show a sign or symptom of something. So 162 residents have resolved, and 74, unfortunately, we have lost at Graysdale, resident.
And this is since onset of the disease
3-6.
diagnosis?
3-6, yep. So total employees, we have 57, and 6 of those we found through universal testing. 10 of these were inconclusive or rejected, and like I said, there were still 4 outstanding from the Bureau of Labs.
So what happens with the 10th? They have to resubmit?
Yes, so we either set up testing ourselves or they can go to their own. I know CVS has a contract with Department of Health.
Wow. Does anybody want to ask any questions about any of the data so far?
On the universal testing, that's something that should have been done right from the get-go.
Correct.
I think the state let us down when it came to guidance there, and then that was disappointing. I guess my question is, when you did the universal testing and some of these positive came back, were these people asymptomatic?
Yes, asymptomatic.
Oh, so prior to that, you were only testing for symptoms then?
Correct.
So,
Right. And it is something that, of course, going further, we're going to continue to do the universal testing. The Department of Health recommends doing this first. One is getting a baseline, And then, of course, we're waiting to see what happens next. I've already been in contact with CVS to help us on our next one. We just have to work with Department of Health on when we want to do that next one.
I don't think we've brought up staffing yet. Where are we? Is that an issue?
It is. Do you want to?
You will address that?
Yes.
Yes, we've had about 700 call-offs in the month of June. We had a 40%, almost 40%, was 39 point, I don't know, something for FMLA. We have a lot of folks that did not want to come in. They're afraid of COVID, which is totally understandable, but that also left us short. You know, we consolidated a unit, Tower 7, so that gave us a little bit more staff, but we're still struggling with that. The agencies have stopped coming for approximately 2.5, 3 months, so now they're starting to trickle back in, which will be helpful, just to kind of offset the folks that are still out. I've had, I want to say, 5 people that have been out since March, and they just, you know, doctors note, which is, you know, what they could do, but, you know, I think everybody's concerned about the COVID and thinking they're going to get it, but it's us bringing it in. It's not, you know, the residents giving it to them. But I do think that Department of Health or the CDC, we should have used the masks sooner. I think that would have helped.
Now, we recently had new guidelines that were issued. How has that affected what you've been doing, or is it just similar to what you've already been doing?
Our positive numbers for the residents has gone way down. Now we're using the N95s, which is a different type of mask. So we're using them with any resident care. We're presuming everybody is positive. And no matter where you are in Gracedale, you have to have a mask on or facial covering. So that's something that we have a zero tolerance for. So it's definitely helped. I mean, the numbers, you know, from the employees tested definitely show that. In the beginning, we had more. In the beginning, we had a lot more residents positive. So I think us using the protective equipment, the N95, what the CDC and CMS said to us, is very helpful.
Yeah, well, better late than never, I guess. The only other question I had is, we changed the contract for the rehab portion of Gracedale. How is that going, and how has that been affected by the COVID?
That's been going very well. They've been a great partnership through this whole thing. They still see residents, so they are on the floors. They've been practicing PPE requirements, so they do gown up, they wear the mask, face shield, goggles if they prefer. So we're continuing that to make sure that the rehabilitation for the residents, they are keeping what they have and they're not losing. So we continue to do that. They've been great.
And have we been able to get outside folks? I know we've had outpatient. Is that an option now, or no, because of the?
Yep, still not.
Still not available?
No.
Okay.
No, and we continue to purchase PPE wherever I can. So, you know, I've just gotten, I think it was 5,000 gowns, so I continue to make sure that we have stock, and we are going through them, we are using them better, because we still be conservative, but we're using one per resident. We're able to do that. So
Thank
that's
you.
helpful.
Any other questions?
I know we're not having visitation yet, correct?
Correct.
Is there any idea, I know, and this is evolving, and given what's going on in the country now, God only knows, I think we're going to be dealing with this probably for a long time, as you know. So has that been discussed as to when that might happen, or has that just been said, you know what, since we're not even close, there's no point in discussing it?
We've still been discussing it because we want to be ready for it. So we've already talked about outside visits as soon as we can. We just need to do 14 days of no community-acquired cases. So we are monitoring it. We're in a good shape with our low numbers. So every day we make sure that we look and we watch and we monitor, because we do. Now, the compassionate visits have been opened up, where before it was more of an imminent death where you could allow people in. So now they've opened it up to more mental health. If a resident requires family to visit due to mental health issues, we can do that. CMS has come out with some guidelines with that.
So could you just give an example, like if somebody wanted to come in, what precautions would happen?
So what happens is they still have to get temped. We ask them the questions, but then they get gowned up. So they get the full goggles, face shield, mask, gown, everything in order to go to their loved one. Now, they cannot touch. Obviously, it's still the 6 feet away, which is very hard.
And then I guess I'd follow up with are we using electronic means like Facebook, iPads and that? So people are being able to visit in that way if they wish?
And we do window visits.
Oh, okay.
So-
I was going to ask you that too, but thank you. Okay.
Yep,
Great.
so we coordinated, Donna in our TR department have been fabulous with doing the Skype calls and then setting up for the residents of families to meet through the window on the first floor.
Well, you have a very, very difficult situation out there. And I'd love to put a big sign up outside or a billboard somewhere. Maybe we can use some of this CARES Act funding, put it on roads that says, wear a damn mask. But anyway, I know you're doing the best you can. Thank you.
Thank you.
Any other questions? The only question I had, well, I wanted an update since COVID. Like, it seemed like we're going along and then you're drowning. So, like, what have you thought through and what are you looking forward to? Like, what are you looking at reinstalling? Because it's the new normal now. So what kind of plans and strategies have you come up with as a team to kind of move forward, giving this as it now exists and it's part of what we have to do?
Number one is PPE. You know, we were stocked, but again, I don't think anybody was prepared for what this onslaught was going to be. So I have made sure that I have taken over a nursing conference room to house supplies because I'm not stopping. And we're going to make sure that we have everything we have to change gowns. Again, to be conservative, but to make sure that we have the face masks, to make sure we have the N95s or the surgical, and even the cloth masks for the residents, because some of them don't like how the surgical masks can get fuzzy. They don't like that, especially if you're on oxygen. So we made sure that we are fully stocked. I mean, there was a point where I even ordered 1,200 garbage bags just in case, that if push came to shove and we could not get gowns anywhere, that we were prepared. So that is first and foremost, and then visits. Visits have to be done somehow, some way.
So how to reintegrate the family members? What about Haven? They are not allowed in anymore?
They are. No, they've been in. I had to. There was. How do you tell people who had visits every day from their family and they went to zero? So I needed to keep those mental health professionals coming in as just another support system.
So I guess, I don't even know how to ask this as a question. Clearly, everybody has their own level of anxiety and fear about this, your staff notwithstanding. So what kind of education or assistance can be given to staff, given that they know that they have a job title that is, risk of exposure, but still get them to come to work and reduce some of that anxiety?
So I do updates to them, so they know what's going on in the facility. There was a time period when I couldn't see, so that was a little difficult, but but I make sure they know. They should know what's going on. They're coming into work, but we also work with HR, and we have the Employee Assistance Program. So I make sure we have cards. Mary Lou does a great job of making sure the word gets out. They actually send us information, and then we forward it out to the staff to make sure they have it. And I have calls, they come down and talk to me. We're very open. So anybody has concerns, we show them whatever they need to ease that. I've walked up to Tower 10 with staff members saying, oh, anxiety's there, but we have the equipment we need, and then they're fine.
So,
Staff development and
Oh, yep, staff development and they're wonderful. Maggie Schaefer, who's our infectious control, they go around. They do the intense training. It's really every shift, they come in at all hours just to make sure everybody's comfortable with what they wear. And they're doing the proper, infectious control prevention methods. That is the key to everything. Don't get face mask fatigue. Wash your hands. I put in all my emails. I'm sure they're tired of me saying, sing happy birthday. we need to do it. It needs to be in their mind.
So conversely, how much of an honor system do you have on the other end? You have employees who have family members, you have employees who, because like he said, it comes in.
Right.
It doesn't develop there. So what kind of honor system do you have in place for somebody who goes, oops, I was traveling, or like, what's the protocol for staff?
It's been very good because we have people, especially vacation season, and they'll call me and say, Jen, I'm going here, just to Missouri. Is it okay? Do I have to come back in quarantine? Like, they are very open. I'm going to the beach. What should we do when I get back? People are very, very open.
The staff police themselves too.
Yes. Oh, yes, they do. They're very
Each
good at
other, you
policing.
mean?
Yes,
Absolutely. Which I think is good.
right. Sometimes it's easier coming from your peer, say, hey, listen, go wash your hands. You just came out of that room.
The only other question I had regarding you guys is the new funding and any other updates on how that's going with.
Like I heard Mr. McClure say, the money is coming in, and again, it's a one shot. We are putting it to use with hazard pay. We're looking at infectious control measures, because again, it has to be used for COVID means. So we are looking at, I can purchase PPE with it. So this is the time where whenever we needed something and we could help with infectious control, we're doing it. Because we have till, I know the one money is till November 30th. We have to spend it. We must spend it.
Oh, so this is additional.
Yes.
No, I was referring to the new funding system, because that came into place this year. And did the rate change because of COVID or not? It's still.
Yeah, we're still working on that with CHC, because again, they've been blindsided as well. What they didn't expect to maybe pay, now they had to pay for testing because it was covered. So we're waiting for all this to shake out with the payments and everything. But Medicare was one to come right away and say, okay, anybody with COVID is jumping up to this. You didn't require any hospital stay. You didn't require certain things that you normally would have to.
That's good news.
Yeah.
I just have to commend you. Because I know everyone's first to indict you and all the loved ones, you've probably taken it. But the fact that we are the largest nursing home in the state, it's awful when anybody dies. But our numbers compared to other places, and the fact that it's controlled and was controlled so quickly, and you guys worked so hard, and I think everybody here really appreciates that. Because I've had friends die that were in other nursing homes that didn't take the precautions that you did. And like I said, it's horrible when anybody does, but hearing that you guys were controlled and everybody else is popping up, it's like, thank you for what you do and putting your lives on the line for us.
Thank you.
And that's the end of my spielkes. Okay. Do you have anything else that you can think of?
No? Well,
Tell Brian we miss him. We'd like to see him next month. or-
yes. When I realized, I had approved his vacation.
Well, he's my money guy.
He is. So he'll be
Keeps
ready
it
for.
simple. And no other hints of funding from any other sources potentially? Not yet?
Just through, we're looking at all the government funding. We applied for every COVID money there was. So there's money coming in.
Okay.
Yep. Wherever it's at, Brian definitely is going to find it.
Okay. Thank you for your time.
You're welcome. Thank you.
The new Director of Children and Youth and Families Division.
Our nursing folks,
See? That should be done between every person.
You're welcome. Would you like this?
Yeah, I was thinking, I could leave that here for you. Yeah, I'll
Well, I
leave it here.
wondered that. I didn't know if we could,
Could you wipe this off? Because Mr. Spadoni breathed on
but just
it.
here.
Thank you.
Hold your papers.
Meet the new boss.
Are you ready? She told me I can't touch this.
Just don't
for 10
touch it.
minutes.
So,
Thank you, everyone. Enjoy your holiday.
thank you too.
So, hi.
Hi. How's it going?
It's going well. We have a couple updates for you today. We are all back in the office. We are all backfilling positions. I brought with me today Kim Kickline, who is the new Assistant Administrator. So she will be doing a lot of the duties that I was doing. Sorry. So, we are backfilling her position as well. So at the administrative level, we have 3 or 4 new people in seats. We have 1 vacancy at the administrative level. And then we have, I think, 2 or 3 supervisor vacancies right at this point. Our total vacancies are 21 right now. We have 9 positions that Kim is frantically interviewing for. We have 1 position that they're scheduling the interviews. We just got the new civil service list. We have 2 positions that we are waiting for civil service lists. And then we have 9 additional positions that are waiting to be posted internally. So as people are moving, transitioning, and so forth. Out of 37 people that moved this year, just in 2020, from children and youth, 12 were actually promotions within children and youth. 9 left children and youth for other DHS divisions. 7 out of the 37 actually left the county. 6 took lateral transfer within CYF, and 3 actually retired. So those are our staffing changes for this year. Since we've been back in the office, having this many new people at the administrative team has kind of been fun, but I think we finally figured out who does what. And we're moving forward, so it's a little bit of growing pains, but we're getting back in sync and starting to groove as a team. So that is very good. We started a couple of new initiatives, obviously with the diversity awareness discussions and everything that's going on. We're bringing in those trainings, and we're working with Sue and the DHS team, and as well as CYF level. So we've got 2 different sets. We've reinitiated some of our placement case reviews. So as children are in care 8 months or longer, we actually do these reviews and make sure. It's very easy when you're doing a case and you have a supervisor and your caseload is 15, and whatever case is really hopping that day or something's going on, you see this case. But when you actually sit back from the outside, so like Kim and I will be helping our teams review cases and just the outside view, coming in and making sure we didn't miss any steps and making sure we're getting everything in place. The services are all been referred to. If there's any type of SWAN services and child prep services as we move towards termination, if that's the way it's going. So we've restarted those case reviews. We've initiated the same type of case reviews for our ongoing cases where the children are not in placement, and making sure we're not staying in people's lives longer than we need to, making sure we are providing the correct services and moving forward. We've initiated the LBGTQ. We have a work group coming up, so making sure we have the right services, hopefully working with Bradbury Sullivan and Valley Youth House so that our teens have a place to go that's appropriate, as we are starting to have a few of those on our caseloads, and making sure we're working with them correctly. We have reviewed our onboarding process. I don't know if I mentioned that we had 37 vacancies so far this year, and it's July 2nd. So we are better looking at how we bring staff in, how we train them. Obviously, with COVID, it was a little bit more difficult to do our mentoring system that we have in place, but we're also looking at how we can enhance that and build so it's not just 2 or 3 people taking the new people out. We've run into difficulties when we weren't letting them drive in the same car together. So we have the social distancing and stuff early on. How we can better bring people in and review what's going on and making sure they have the support they need both in the field and in the office. We filled our child and adolescent needs and strengths, our CANS assessment specialist. So so she has started, I want to say 2 months ago, in this position. She's become certified to do the CANS assessment, and she has done 25 assessments so far. These are for all the children that we do go into placement. She actually goes out, it's about 2.5 hours talking to the foster parents, talking to the children, and then another meeting with the bio parents, and just looking at strengths and needs and what services that family truly needs versus what we kind of think they need. So we're running a little bit more on data. And with that, we've also started a data usage group. So we have to report our statistics to the state. We get them all back in a big data packet 6 times a month. We look at the top three that the state says we have to fix, and sometimes we don't dive deep enough into the other things with how we can fix. So we've started to build a data review team. Some of it is with the other DHS staff, and I've asked people from our advisory board, and we will be asking some of our providers to sit on that data review team. So we use our data better and make sure we're providing services better to our families. And then my favorite part is we were able to obtain a couple of additional fundings for emergency food and shelter through the CARES Act and stuff. And I'm proud to say that we've served over 4,000 families with food assistance. And we've served an additional 25 families where when COVID first hit and everything closed and everybody went home, WIC, County Assistance Office, a couple other places took them a while to get online. So we actually used some of that funding. My office, Kim's office, a few other offices are full of diapers and formula right now. So we're really trying to help all of our families. And we've been able to help the 25 families, 33 additional children as they needed, as families aren't working. So we're trying to help provide to any county resident just to keep them out of our system. So all of DHS, anyone can come down and we have to count families. So, we have one little form you have to fill out and take diapers and formula as we need it. And we have gotten that word out to some of our providers, our visiting nurses partners, and other community people. So that has been going very well. And then since we've turned into the green phase, we've restarted. Our court hearing started maybe 3 or 4 weeks before we actually hit the green phase. They are doing a lot of our review hearings by Skype and other electronic means. Some parents just call in, some parents are able to Skype in. And Mara is working with our courts, Mara is our managing attorney, is working with our courts so that they can actually do Zoom visits with some of the children. So the guardian ad litems get to see the children before the hearings through the Zoom version, just to get the updates and move forward. So we have started the review hearings again. We are starting to have visits in person between the children in placement and the bio families. We just put out our protocols on Monday, so the visits can restart. We've worked on how we're going to keep the toys separated. We took all of them out of the visit rooms. We're just bringing in a couple at a time, making sure everything's sanitized in between. So we rolled out all those protocols, and our caseworkers are starting to do more home visits into the field as well. With the expiration of the county declaration of emergency, we can still work with the state declaration so that we are allowed to use video conferencing, but we have to better document so it's not just like because of COVID, we're not going to go visit. If there has to be some other reason. So we've set up our screening questionnaires. We asked the family to sign off on them that, if they've not been positive, if nobody in the house is half symptomatic, we're actually going out to the house. And we are thankful that through both Sue and Mr. McClure, we have been able to get a lot of PPE for our staff as well. And we were able to go out and do the visit safely. We have not missed any of our response times throughout the whole time. So the initial assessment and for any high-risk case or any case with high safety means, we have been going into the field straight through. And I can proudly say that my staff has risen to the occasion and come up with some great ideas on how to do this safely. We've worked out a system where they actually split into teams. We had 3 separate teams. So we had somebody in the field for 5 days. And then just by the fact that we have 3 teams, they were out of the field for the next 2 weeks, which gave them that 14 days if they were going to be symptomatic before they went back in the field again, so we wouldn't cross-contaminate our staff and our families. So did some creative thinking, and they did a great job. And with that, I will open it up for questions.
I have so many, but not really, just because my brain starts when you start talking. Your kids in placement, total number of kids in placement, ballpark?
298, Monday, as of Monday.
And can you give me a breakdown of where they are in placement? Like how many foster homes, how many therapeutic? Sorry, I should have asked you ahead of time, but it just hit me today.
Yes,
as you were
As a
talking.
matter of fact, since you asked, I have 298 in care. I have 188 are with vendor agencies in foster care. I have 3 that are in county foster homes, and that would be non-kinship foster home. I have 105 that are in kinship foster home. I have 27 in congregate, and I have 2 left on the run.
Say that again? I heard you. They'll come back.
They always do.
That's right. Literally.
They eloped from either their biological home after we got the order, or from a foster placement, or their place of placement, and we have not been able to find them yet. So we have 2 right now that we are actively looking for with the police.
So what's a reasonable length of stay? Is there such a thing?
Um,
I love your reaction when I ask that.
It truly depends on the situations. A lot of times, if we get children in while parents are getting drug and alcohol treatment and the treatment is successful, it might be 6 to 9 months in placement. And we're able to still keep the case open, but send those children home. When we're not successful right now, I think our time to permanency adoption or legal custodianship is somewhere between 18 and 28 months, somewhere in that range. Depends on.
From onset of case?
From the first placement, yeah, from onset of placement. And then there's a whole ballpark in between. So if we have children in care with family that doesn't have, once we place the children, sometimes they lose their Section 8. So as we help them with housing and those kinds of things, until things are stable, it could be a year and a half. And hopefully when we start doing these placement cases reviews again, we can move some of that up as long as we're catching everything. And as I said, sometimes it's easier from the outside to look in and say, well, you didn't do this or this yet, but I also don't have 15 cases on my plate. So it's easier for me to look in than it is for the caseworker and a supervisor that are juggling everything every day. So that's why we reinstituted these.
Hopefully none of mine are on your case law. Which brings me to my next question, because I just thought of it today. What's your level of responsibility in terms of reporting to providers? Because and providers are, like, somebody's in care, say somebody's at Kids Peace, and they report in the course of care that maybe there's some familial abuse.
Mm-hmm.
So it becomes part of the treatment plan, they get released to home.
Mm-hmm.
Isn't Kids Peace supposed to call you and let you know, or like, does it depend on the level of? Because when I get them at my level of outpatient care, all of a sudden I hear, oh, my dad was beating me with shoes for 3 months. And I'm like, how come I never heard about this from children and youth? So, like, how do we deal with those gaps of service?
Whatever's reported to the providers, all providers with children come before you are mandated reporters. So their level of reporting to us and to Childline is pretty high. For children and youth, when we refer to services, we should be disclosing anything that would affect their treatment. We try to get our releases of information signed. If we have legal care and custody, we can release the information about the child and that he was abused. We can't give you specifics who, what, when, where. Sometimes it depends on where the case is, if there's criminal charges, what the DA asks us to not disclose prior to any criminal proceedings. So there's a couple, but we can tell you what happened to the child. We may not be as specific, but at least you'll have the background for treatment purposes, if that makes sense.
Yes.
So we should be disclosing. If we're not, you should be asking. And if the caseworker is not telling you, they're supervisors to come up to level. We do try, that's one of the training pieces, because everything we do is confidential. We can't say anything to anybody. And where this line is, sometimes they forget that part of treatment is we have to know everything about the child. Same thing when we put them into foster care, any type of placement. The more we can tell them about what's going on with the child, the less disruptions we'll have in placement cases as we move forward. So it's that fine line of not crossing the bounds, not ruining a case, but making sure everybody's getting the services that they need. And I think with our CANS assessment, that's going to help us even more, because as we have somebody working with these children, talking and actually documenting, if you've ever seen the assessment, it's pretty extensive. It's about 2.5 hours that she spends. And once we have all that information, it's almost like a giant biopsychosocial type of thing. It's more information that we can give to the providers so that and we'll be more able to target the correct providers. So when we know where those needs are, where those strengths are, we already know where some of our provider strengths are, we'll be better able to match those.
Thanks. What else? You answered my question. I was going to ask you about live visits and when they started. How's the transition gone? I think you covered it. What do you think of this evidence-based thing she's trying to talk to us about?
I absolutely like it. I have been on a few calls with REMA. I have heard very much about it through Pennsylvania Children Youth Administrators. I have been going to those meetings with Kevin, I think 2015. It's when the new laws came out is when I became the Child Protective Services Program Director. So they were talking so much about the new laws, it made sense for me to keep going. And then we liked having two sets of ears, so we kept going. So I have heard Allegheny County's been working with, I think REMA built Allegheny's model. They've had it for quite a while, so they've actually done a couple of presentations for all the administrators at PCYA a couple of times, and I am very fascinated by it. I will always welcome a tool that helps us make a better decision, either to be disruptive or not be disruptive in a family's life. Sometimes going on instinct is not always great, and when you have anything that helps with that, not rely solely on, it's one tool, it's one piece of our toolbox, but when you have that, I think it really makes sense to be able to help our staff whenever we can. And again, did I mention I want to bring data into our agency a little bit more as well? So when Sue started talking about that, it was like, there was a perfect match.
So where does it fit in their scope of practice? Like on the day-to-day?
It's more at the intake level. As we get new referrals, Allegheny's actually takes information from their current system, shoots out a score. So when we start screening calls, we get a referral. These are the allegations. This is what's going on in the home. Allegheny, when they first started working, made their decision. We're either going to open this case, we're going to screen this case out, we're going to refer it for a diversionary service, and our agency won't go and look at the children. Those are our three choices for a general protective services case. For child protective services, our choice is we have to go out. So it won't affect any of our child protective services cases. For our general protective services, what Allegheny found is some of the cases they really thought were high risk. The statistics are saying if we don't bother that family, this is a once and done type of thing. And while it doesn't change, there are certain safety factors and things we have to look at. We have the state risk assessment, we have the state safety assessment, but we probably screen out maybe 38% of our referrals, give or take right now. Doesn't rise to the level of abuse. There's no active perpetrator per the Child Protective Services law. There's a lot of reasons why we don't go out on every case. To know that statistically this is going to be a really high-risk case, before I screen it out, we would at least go out to the house to find out, and that's how Allegheny uses it, which makes a lot of sense to me because they've had a little more time to play with it and move it. So it's just one of those things, maybe before I screen something out that could be dangerous and could come in much worse 6 weeks, a month, or 2 months from now. If I go out sooner and we put something in to prevent, that would work. And it kind of made them rethink how they feel about certain things, and it takes away some of the racial disparity because the computer doesn't look at race, it looks at these are the other factors going on in the home. The fact that it can look at our data system and know that it's somebody's involved with mental health, somebody involved with somebody else, and just put that one more tick in there. The computer knows what I don't know, so it just gives us a slightly different score, and I think it could be very helpful. Again, one tool, it's not going to change how we do practice, but it might change 1 or 2 cases where we're not sure we should go out and we go out and disrupt a family, and 1 or 2 cases where we don't think we're going to go out and now the numbers are telling us maybe we should. So I like it.
Cool. Anybody else have questions? I monopolized your time, sorry. Go ahead.
Mr. Heckman?
I just wanted to ask you, how's you mentioned about the staff vacancies, how's the turnover rate going? always been an issue in that division particularly.
It's still a pretty good, if we had 37 rollover for the first 6 months out of 145, if I'm fully staffed, that's a good statistic. They're still moving. We have a lot of new staff coming in. Our seniority, for lack of a better term, experience, we're losing a lot of years' experience. And I say that as Kevin stood here with 45 years and I stand here with 19. So we're at every level, we're losing a lot of experience. When I first started here, most of the supervisors were here 20 years. Right now, I would say our average is 5 to 8 in those seats. So our turnover is always been a pretty big issue, and it's not slowing down right at this point in time. We are starting to look at how we onboard and how we better invite staff in and how we better support them. So we took a harder look at that after COVID because we realized a lot of what we do in the office is not, it doesn't go anywhere besides the office. So how do we better support them in the field? How do we better support them everywhere so that they feel comfortable and they can stay longer? So.
Yeah, I guess, in all fairness to you, that's been a problem that predates you by decades.
Well,
human services in particular.
Yeah.
Do you find, because you've been there and now this is your, you're new in the seat, and I get it in that sense, but is it still a combination of pay and stress and the fact that once they're around a while, the rules of our county rules and their union contract, they can then put in for any vacancy anywhere else and immediately jump to something that's maybe less stressful? I guess I just wonder, do you still see that dynamic at work?
absolutely. I'm not going to glare at Miss Crush right now, but absolutely.
Oh, you can.
And then I guess the other question is,
I didn't put my mic on, so before, I know I'll be written up for a lot of things, but I want to make sure I get my mic on. That the people now are back in the building. How's that going? Because, there was some dissension, and that was expected. But has everybody seemed to be getting back into the flow of things? I think a lot of your staff seem to be particularly upset.
In all fairness, I have more than half of the human services staff.
Right.
So-
No,
so yes.
this isn't
But-
like somebody did something right or wrong thing. I'm
But,
just curious because they came in, it's
were
not a
vocal.
secret. They were angry, but that's the way it goes, and they had to come back. I just wonder how it's going.
I think after the first week, the nerves and the jitters are much more calm.
I was just curious.
We have, I think, 1 or 2 that are still on in the private rooms downstairs, so we were able to accommodate the ones that needed accommodations. I don't know if Tiffany still has, but I have two people that are downstairs, so they're in a single room, separated from staff. My staff that have offices, more of the doors are open than when we first came back. Everybody's door was closed with knock, make sure you have your mask on, make sure you give me time to put my mask on before you walk in. So a lot of that has really toned down. And the caseworkers are trying to be social again. So when you put a bunch of social workers together, sometimes my job is just to walk through and say, I don't think that's 6 feet yet. I don't think that's, so trying to break them up again. But it's much
You're a
closer-
COVID policeman now, huh?
Yeah, but it's closer to they're comfortable talking to their coworkers and being a little more supportive of each other instead of hiding in their personal little cubicles. So
Okay.
I think it's much calmer.
Thank you. That's all I was curious about.
Mr. Myers?
Do we have many call-outs since the first week?
We do not. I do have a couple on family medical for various reasons, not specific to COVID. But I don't have a lot of call-outs on any given time. Once in a great while because somebody's babysitter was sick or something like that, but that's to be expected when the daycares are just starting to open again. And I don't have that many. I think when I first tracked them, I might have had 2 or 3 unexpectedly, just because I didn't think they wanted to come in versus something else going on. And I can only answer for my division, so.
Anybody else? Okay,
Thank you very much. And my turn to wipe it.
so now Tiffany's gonna do a whole dog and pony show? No, I'm just kidding. I just wanted to see her panic.
I'm not on the agenda today.
Come on up. I have questions.
I have to wait.
Wait till she spritzes.
You have to wait. And don't forget, it's.
Tiffany, you come soon.
3 minutes. I'm very clear. Dawn is very.
Oh, well, come on. I won't stop you. Come on up. Come on up.
Thank you, Ms. Bader.
The counterparts from the justice system weren't with you, so.
I texted Tiff, I said, we're kind of on a roll here. Maybe Ms. Fargo Hefner wants to ask you about the ORLTSR tonight instead of waiting until August, but we can see where
That's
we go.
because she wants to hear it too.
It's up to you. Yes, I get bits and pieces from Tiff and Christy. I have a short agenda. We received a few letters from Graysdale, and I know how much y'all love that brag book Ray used to bring, but he always left it here, so I just choose to bring and read some of them for you. So we have a really long one. It actually took me a while to get through the handwriting, but I highlighted some things that, as you said, Ms. Fargo Hefner, we get a lot of bad press, and it's nice when we get some compliments too. So we had one woman send Jen a handwritten letter, very long. Her brother had been at Graysdale for 6 years before he passed away. And I won't even read the whole thing, but she honestly goes on and on about how wonderful the staff were. I mean, she says thank you about 18 times just in the course of 2 pages, and talked about how the folks there treated them all like family, and they were a family to them. And she gave some special shout outs to Tower 8 because that was where her brother lived. So Jen warned me before I read this that I had to have my tissues ready. And you did actually make Jen tear up there at the end, so that was good. So I will, in case anybody wants to read the whole letter, I can leave that. We got another email from someone who, their loved one, the spouse is at Graysdale, and she was furious with the headlines about Graysdale. This was probably about 3 weeks ago or so. And so she wanted to let Jen know that she was very unhappy. That those headlines do not do justice to Graysdale. She says, Graysdale is one of our jewels in our county, and without it, we would be lost. This just puts a black stain on Graysdale when they have given such good care to the residents there. It's a wonderful facility. I think you need to tell them to tell the whole story, which we try to. They tell what they want. That's just how that goes. And somebody else had sent Jen an email thanking them for assistance getting his mom into Graysdale, and we've talked about Tower 10 being the isolation unit, and I know one of the folks who came to council a month or 2 ago had some criticisms of one of the staff members who was maybe not as obviously as appropriate as he could have been. And so this particular person was highly complimentary of Patrick and his crew on Tower 10, so different folks, but I like to give those folks the shout outs. We are rapidly firing out our contracts. I'm sure the county exec's hand's ready to fall off signing all of those. If I didn't mention it already, what we decided to do, because we were not sure, we're still not sure what our funding will be. We have our funding allocation for the first 5 months of the year, and then we'll see what happens the second 7 months. That doesn't make sense, but you know what I mean. So we did our contracts at 50%. And told providers when we get the rest of the allocation, we will let them know how that will play out. The good news is, with the CARES money, we, for drug and alcohol, mental health, and our homeless assistance money, we will be able to have our contracts as we had hoped they would be. So at least for fiscal year 2021, we will be in good shape. Even if there's a state budget cut. So we have to see what happens the next fiscal year when there's no more federal money coming in to help us. So that remains to be seen, but those are well underway. For folks who didn't see the press release, we had QPR train the trainer in our building
almost 2 weeks ago. QPR stands for Question, Persuade, Refer. It is suicide prevention. It is for suicide prevention what CPR is for heart attacks. And we used the money we had allocated for the task force to have 10 folks trained. We were originally going to plan for more. COVID hit. We had to downsize a little bit to social distance. And then 2 people on that morning, I forget if they were ill or there was case emergencies and they couldn't go. So we have 10 folks. They will all be required to do 6 trainings per year for the next 3 years. And the trainings are generally 20 to 25 people at a shot. So part of the goal is going to be, over the course of those 3 years, is certainly all of our DHS folks, and then, I'd love to take it beyond to all county employees as we are able to. But the 10 folks who are now trainers kind of spread far and wide. We've got St. Luke's and Lehigh Valley Health Networks, some school folks. So it's really a nice variety of community members that they will be able to target. So we're really proud of that. And I don't know if folks saw the PBS coverage on that. It was really, really well done. Stephen, the reporter who did it, really spent he's probably there for about an hour and talking to a few different people, and it was one of the best coverages of the topic I've seen, so we were happy about that. And really the only other thing, and this sort of ties into our conversation about REMA and our predictive risk model for children and youth. One of the topics that has been important to me for a long time that I wanted to figure out how to cover in DHS was implicit or unconscious bias. So last year sometime, Robin, my deputy, and I were working on that and trauma training. So the initial priority was trauma training and getting all of our DHS folks trained. So I'm proud to say that all but about a handful or 2 of folks in June finished their kind of first round of trauma training, and people are tired of trauma training. So that's okay. It's still important. We need to now take it, kind of like trauma 102 and 103 and 104, not just our basic trauma training. So it had been my intention this year to then focus on how do we start talking about implicit bias and conscious bias in DHS. And of course, then everything has been going on in the country as it has, and so the timing was long overdue and right for us. So I worked with the administrators to get suggestions for folks in DHS throughout the building to get a representative sample to develop a work group. Because while I have ideas about how to roll this out, as I told the work group in email so far, I'm a white woman. I can't presume to know how to necessarily go about doing this as best as I can. And my goal is to do it as well as we can in order to engage as many folks as possible, right? We have some folks who we know will be resistant, and so how do we work together from the beginning to create a safe environment where we can have these conversations and then spread it through all of DHS? So I sent out the email earlier in the week. Actually, the initial invite went out earlier in the week. I think I've heard back from, I think there's about 15 people. I've heard back from all but 2, and they're all resounding yeses. And we are going to have our first meeting next week on Friday. And I've had some individual conversations with some of those folks, and we'll continue some of those conversations as well, because again, I want to make sure when we start meeting, we're at a place where we can create a safe environment for what are hard conversations. So that's what we're doing at the full DHS level, but Julie kind of segued perfectly without knowing it for me into, reducing the racial disparity in child welfare, and part of what we're hoping for with the predictive risk model is that it will do just that. And interestingly, as an aside, I apologize if I mentioned this last time, but it's worth repeating anyway. I was on a webinar and they talked about, with Rima and her folks, they had Allegheny County and Colorado and California who all use some version of this model. And they talked about COVID and child welfare. And one of the things we've all talked about is how much our calls went down to children and youth during COVID because the schools were closed, the doctor's offices weren't doing well visits. And what they found was the referrals we weren't getting were those really low-level risk referrals, but we were still getting kind of the more urgent ones. But there was a disparity when Allegheny County had some supervision issues and retirements and remote working, the racial disparity creeped back up when people stopped relying on the model as much. So they made the corrections and that circled back, but the timing is right for that as well. So looking forward to being able to talk more about that, have Rima if you folks feel like you want to do that and keep that ball rolling. So that's what I have.
Anybody else have questions?
I do.
Mr.
What's your ultimate goal with the racial bias?
I have my thoughts, which I can share with you, but what I have decided is that I'm not going to be the driver of that. I'm going to let this work group be the driver of that. But ultimately, it will unfold as it does. But we are talking about trauma, historical trauma, how that impacts how we work with our clients, our Black and brown clients in particular, and housing discrimination, employment, right? So how do we have, and Mr. McClure's talked about this, how do we have a workforce and promote folks that it is more representative of our county structure? And, we've made an interesting shift since I started in terms of it's not all men at the top anymore, but we're consciously working on also having a more racially diverse, not just workforce, but supervisory level. So I don't know if that answers your question. Those were some of my initial thoughts, Mr. Myers, were to have, to start the conversations and have training with folks on the topic, diversion, equity, inclusion, but not just, here's your diversity training again. How can this lead to meaningful, impactful, lasting change within DHS? And I've decided that I'm not going to totally push my agenda to the side, but I'm going to push it to the side, and I'm going to see where that work group takes us.
Okay. If you're going to deal with issues of race, and it's a very sensitive issue at this point right now,
Yes.
you must build respect from both ends to start that to go with. Because what's missing in this equation is that there are two different histories, and there should be one of the Americas. So if you're going to handle this, and if I'm hearing you correctly, you're going to have a panel of people, they're going to set up some sort of criteria. Is that what you're going to do, some of the employees?
It will be about 14 employees, and honestly, it's going to be, I have my opening kind of spiel that I'm working through, but it's going to be an open forum to talk about, first of all, what are the issues you see in the workforce? For example, one of our program directors in Julie's division, Lorraine Bartholomew, and I have had one long conversation so far. She's going to be part of the work group. And she has given me her perspective on this topic. I don't want to speak for her here publicly, but we've talked about that, and we've talked about her feelings on how we traumatize our minority families and children and youth. And we've talked about the lack of diversity in management in human services. And she said she's been talking about this for 16 years. And I said, I'm here to listen. And she said, well, just so you know, Black folks don't trust that easily. And I said, well, I can appreciate that. And I said, I am not foolish enough to think that you will trust me, and certainly not after one meeting in a nice little work group. And I said, honestly, I hope you trust me someday, but that's not really what matters at the end of the day. What matters is what actions am I going to take, and am I going to lead this team to take, and we will do together. And that will tell you whether or not I'm walking the talk.
Okay, one of the issues, as I can say for myself, there's not a lot of people of color in management throughout this valley. I spent 26 years at Lafayette College. I was the only Black supervisor.
Wow.
Yeah, that's a little ridiculous for people to make the kind of money they do. What's your ratio? How many supervisors you have of color now in your division?
I actually have no idea, but it's certainly not representative of what the, what our county population is. I know that since I got here, very soon after I got here, Mr. McClure and I discussed that, and that was one of his priorities, and my priorities are his priorities, but that was mine anyway, we're in sync there. So we have promoted folks who are not white, but we have a lot of work left to do.
Let's not just promote them because of people of color, let's make sure they can do the job. That's the
Well-
most important, that to me, I want to make sure it's out there because so often it
correct.
blows back in our face. You put somebody in there because
No.
a person of color.
Somebody has asked me, and I'm glad you said that, because sometimes I make assumptions that things are, that you all
Transparent.
are thinking that, what I'm thinking.
Right.
But you don't. But people have asked me before, many, I don't know, 10 people maybe in my building when they haven't been promoted or they haven't gotten a job, why didn't you hire me? Frankly, first of all, it's one of the hardest questions to answer for me, because it's not an easy answer. And I always tell folks, criteria number one, you have to be qualified, right? So, and that's not even in my hands, that's an HR thing. Do you meet the qualifications? Yes, you do. Then I consider everybody. I don't necessarily take number one, I don't necessarily take number three. Honestly, I hire people that are qualified, that I know can do the job, and that I trust. They don't trust me, but I feel like I can trust them. And so that's why, honestly, it's hard for me to articulate to somebody why they didn't get the job. And I remember one person in particular who I'm exceptionally fond of and will be promoted at some point someday and will be really great at that. But it just wasn't the right fit, and it has nothing to do with the lack of qualifications. So I agree. First and foremost, you have to be qualified. But after that, then there can be some deliberateness in our decision. People have to not be, some of it is, I'll stop rambling after this, but some of it is people have to not be afraid to hire people who are different than them. And I'm not just talking skin color, I'm talking any kind of differences. I always say that I hire people who are not like me. I don't need another me. I need people who have the strengths where I have weaknesses. So that's the kind of team that I try to surround myself. I'd like that team to be a little more diverse.
Anything I can do to help you out, feel free to
I appreciate
give
it.
me a holler.
I did
have a
reach
little
out to your
I got a
son.
little experience in this.
Just a little. Thank you.
Tad. Anything else from anyone else? Mr. Cusick?
What's come up from time to time with regard to hiring is the civil service process. I heard it
yeah,
came
where
up
are we at?
again earlier this evening. I know earlier this year, the state was trying to make some changes,
Yep.
and we were debating whether to get out of it. Any updates on that?
I do have an update, and I don't know how I could have forgotten that, so thank you, Mr. Cusick. We heard from Civil Service, and we got a list back of things that they need from us. And the best part of the letter, this came about a week and a half ago. Best part of the letter, Liz likes to tell it, is the bottom says, anything not referenced in this letter is satisfactory for us. So,
So we're on our way?
yes. So, we have probably about a half a dozen, 6 to 8 things that we have to do. Mr. Heckman's not sitting here to hear about according to Liz, the overachieving Georgine Corpora, my assistant, who's, before we even had our phone call, was done with everything that she could do. And I took care of most of my things today. So we are reconvening, Liz Kelly, Kathleen Wedge, myself, and Georgine on Tuesday via phone. And hopefully within the next 2 weeks, we can have the rest of the documents compiled. They needed some things put into formal policies. So the pushing paper here takes a little bit of time, but the only thing I'm concerned about potentially holding us up is needing the wage scales for our PSSU folks. And while we have a ratified contract, that's still an ongoing conversation. So everything else, though, will be very easy for us to get. So I'm going to hope before the end of the year, but stay tuned.
Going back to one thing, have you set up or put out anything in black and white as to what criteria someone might want to follow to
I'm good. I can hear you.
follow that they may want to take under advisement or in their head and say, okay, this is what I need to get promoted? Have we put anything out like that for them?
I'd have to go back to my administrators on that. You know, all of the,
You're asking for
positions-
criteria, yeah.
all of the positions, right, they list what criteria you have to have. And most of them, if you've gotten into the door, you have the basic criteria. I don't think we have any positions any longer that require a master's degree to be promoted, so most of it is just years of experience. So certainly those are all publicly available to our folks. And I know since I got here, succession planning was of huge importance to me, especially with, you know, Mr. Mailer being ill and retiring, and Mr. Dolan retiring, and Deb Nunes passing away. I mean, it just kind of went on and on. So we have actively tried to ensure, first of all, there's 2 people who know how to do every job in that building, and that we are mentoring folks to prepare them to be promoted.
Thanks.
Sure.
Thank you.
Okay. Any other questions? All right, motion to adjourn. Thank you.
Thank you.
Hey, Carrie. How are you?